Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Rockville, Maryland, discussing the latest advances in dental technology and how they can help restore your dental health and improve your smile with two of this area's top dentists, Dr. Cheryl Callahan and Dr. Joyce Thomas. Dr. Callahan earned her dental degree from the University of Michigan. Dr. Thomas earned her dental degree from the University of Pennsylvania. They are both members of the American Dental Association and the Maryland State Dental Association, as well as the Academy of General Dentistry, among others. Welcome, Dr. Callahan and Dr. Thomas.
Thank you.
Thank you.
Oh, it's our pleasure to have you both on our program. Your first time, in fact. We've got a lot to talk about. I understand there's some patients that are going to be joining us a bit later as well. So I wanted to begin first, if I may, with you, Dr. Callahan. There's so many advances that we know that have taken place in dental technology over the years. If you could please tell us what some of the more significant ones are.
Certainly. The first one would be Invisalign. Invisalign is a type of orthodontic procedure. So what Invisalign is a series of liners that eliminates bands and brackets during orthodontics. So what happens is a tray like this, which is a firm plastic, is fabricated at the laboratory, and it's changed every 2 weeks from a start to finish point. So once again, digital impressions are sent to the laboratory. They're fabricated a series of trays. Some patients will take 10 of these trays to get their teeth straight, some 30 trays. And every 2 weeks they change these and end up with a great result. So it eliminates all the bands and brackets. And what it has done is it opened up orthodontics to a lot of adults that may have wanted some correction done but didn't want to have to go into braces. It's also allowed some teenagers to have some minor tooth movement with Invisalign. So it's a tray system that moves the teeth on a gradual basis. Nobody knows you have them on.
They're basically like invisible.
Exactly.
Invisible braces.
Invisible
For the
braces.
busy professionals that need that, but at the same time don't want people to know they're wearing braces.
Exactly, exactly. So it's really expanded and helped a lot of people that haven't been happy with their smile be able to improve their smile very easily.
What types of dental problems does Invisalign address, doctor?
It addresses crowding, too much space in somebody's mouth, and it helps improve aesthetics and also improve function. So it's used for both adults and children.
That's very good to know. And what would you say are some of the benefits of Invisalign compared to the traditional methods? Obviously, the one where it's invisible stands out. Obviously, we see that, but other benefits that we should be aware of?
The ease. It's very comfortable. You can take them out. So if there are times that you don't want to have them in, you can take them out. It's done on a gradual basis. It's easier to clean, so you don't have all of the hardware in your mouth. So it helps with patients able to keep their mouths healthy at the same time that they're doing the orthodontics.
Very interesting. Now, who would you say, Dr. Callahan, would be a typical candidate for Invisalign?
I'd say the majority of the candidates are probably adults that have some crowding, maybe somebody that went through braces but didn't wear the retainers and now has had some relapse from years ago.
Sure.
Or somebody that always wanted to have braces but wasn't able to, didn't want to wear the hardware. It's also available for teenagers, for people that only need a little bit of tooth movement as opposed to a lot that have a malocclusion as well.
And what type of results would you say, doctor, can we expect from Invisalign? What are we looking at?
Invisalign provides great results. It helps people smile and make them feel good about themselves and improve their overall appearance. Another patient group that Invisalign opens up orthodontics for is patients that have some periodontal issues or gum problems, because it's a gradual tooth movement as opposed to a more forceful movement with full braces.
Dr. Thomas, this brings me to you as far as adding to what Dr. Callahan just said. She covered obviously Invisalign as being one of several areas that benefit with the advancements that have taken place in dental technology, and certainly significant on that arena. What about other specialty that you'd like to tell us about where the advancements in dental technology have benefited us and continue to do so?
Well, one of the things that patients always tell us is, we really like coming here, we just hate what you have to do to us. We like you a lot, so don't take it personally. So something that's made a big difference for patients is what's called remineralization therapy. It's a big fancy word, but it's a pretty simple process. It's different pastes that have been developed that they can apply to their teeth to help stop cavities that are forming in the early stages, to help reverse some of it or remineralize tooth structure, and that way it cuts down on how much we actually need to drill and fill their teeth, which is what they don't want to do.
Very interesting. No, I wasn't aware of that. Now, let me ask you, what dental problems does this therapy correct?
It will help with cavities in the early stages. It can help with people who have root surface sensitivity, either from gum recession related to brushing too hard, or it can actually even help relieve some of the dry mouth that occurs as a result of medications, and cavities that occur as a result of having a dry mouth. So it addresses a wide range of problems.
What would you say, Dr. Thomas, would be the advantage of this therapy?
We're able to be a lot more conservative in cutting tooth structure. Really the goal is to keep as much of your own tooth structure as possible. And by using pastes containing the calcium, the phosphate, the fluoride, it can really help us in our job to try to help people keep their teeth.
Okay. And who would you say would be a good candidate that could benefit from this therapy?
Pretty much any of our patients, but specifically people on a lot of medications, which causes their mouth to be dry. They experience a high increase in the rate of cavities, and so it can benefit them. Patients undergoing orthodontic treatment, because of all the hardware that's in their mouth, have an increased potential for decay, so they benefit from it. Children who have lots of sugar in their diet, this doesn't combat completely the results of too much sugar in their diet, but it can help to offset some of that. Yes. And again, people who have been prone to decay throughout their life, who say they've never had a checkup without being diagnosed with a cavity, it's really made a significant difference in slowing down the rate of the decay and giving them something that they're able to do at home on a daily basis to prevent decay and to slow down.
Well, that's a great benefit right there, and certainly from what you just told us, quite a few folks out there could get help from this therapy.
Yes.
And what type of results can we expect from this therapy, Dr. Thomas?
We can expect to see people have less sensitivity, less root surface decay, less decay between their teeth that actually needs to be drilled by coming in regularly for their checkups, having annual x-rays taken that allow us to see areas that we can't see clinically. So just essentially less decay, less reasons to drill their teeth, giving them more comfort that that the efforts that they're making at home do make a difference, because they find it very frustrating when they say, I'm brushing, I'm flossing, I'm doing everything you tell me to do, and I still keep getting cavities. And by having introduced some of the pastes that are to remineralize the teeth, they don't have that same frustration because they're having more success in the end result of less decay. And it's very easy to apply. Just put a little bit on your finger, rub it on your teeth. Some of the paste they have to spit out, some of them they don't spit out, and we go over with each individual patient what we're recommending for them based on what we've prescribed to them. But really, no one has had any objection to using it, and they come in all different flavors, so people enjoy the taste of them as well.
My goodness, very easy to apply and very effective results.
Yes.
Nice combination indeed. Now I understand, Dr. Callahan, another advancement in dental technology that has taken place that's benefiting a lot of folks as well is in the area of digital impressions. And I wanted to begin by asking you if you can please tell us about that.
Digital impressions, I think, has changed dentistry and will continue to do so. So one part that patients hate is when they have to have a crown or a procedure done and they have to have an impression taken, which is a lot of goop that people have in their mouth.
Yes.
people that are sensitive to gagging. So what a digital impression does is it eliminates all that. So you take an impression with a wand, and we'll show you in just a minute how that works, and with a wand on the tooth, and it creates a image of the actual tooth that gets electronically sent to the laboratory. They create the crown off of that digital impression, and the fit is wonderful, perfect, so it's really advanced dentistry tremendously.
Now, obviously, that's very different than what was the norm prior to the digital impressions. Can you tell us a little bit more about that difference?
Sure. Digital impressions have eliminated for years the way we took impressions, which was to fill these impression trays up with an impression material, place it in somebody's mouth that would last for about 3 to 5 minutes. Now what we do is we take this wand and digitally scan the tooth as we're doing the crown procedure, and that gets sent to the lab. So what we see is the impression of the tooth, and we can actually see it. So if we take a picture and it doesn't look good, we can right that minute see what we've done and retake the picture. So it makes a noise. It's a little bit big, but it has worked out tremendously, eliminating a lot of retakes that we don't have to wait for the lab to tell us, oh, the impression didn't come out or it didn't look so good. We're able to fix it right at the moment. So what returns to us from the lab after this digital impression is sent to them is a model with the actual die that the lab makes the crown on. So it increases the accuracy tremendously.
My goodness.
No longer do you have to have all of that.
Your mouth full of all that goop, basically.
Exactly. It's a wonderful advancement.
The advances from technology
That's right.
that we are now benefiting from.
And it's very soon going to be used in orthodontics as well, not just from a crown and bridge standpoint, but orthodontically.
Very interesting. That's good to know.
Yes.
I wanted to go back to you, Dr. Thomas, and discuss another area that has significantly seen advancement in dental technology, and that is the area of digital x-rays. Can you please tell us about that?
Sure, I'd be happy to. Digital x-rays have helped not only our patients, but also the environment. And the reason for that is that by no longer having to have film that needs to be developed, we don't have to have the chemicals that then have to be disposed of. And we also, it benefits the patients because there's less radiation exposure that's required to capture a film with a sensor than there was previously needed to capture an image with film. And so it's
safer right off the bat, without a doubt.
We don't typically need as many views of the tooth in order to be able to diagnose the problem. It's also improved our communication with the referring specialists that we work with because we can email the pictures to them. And for other offices that also are digital, or even if they're not, they can still pull it up on their computer screen and look at it. Patients, when they relocate in this area, there's people from many parts of the world, they may move elsewhere, we're able to transmit the images to the next dentist that they have, and for that dentist to have a very accurate picture and to essentially be looking almost at an identical version of what we're seeing. Whereas with film, when we had to duplicate an image and send it, they wasn't quite capturing the same with accuracy as with what we see in the office.
Yes, now it's just a couple of clicks of the keyboard and you send it over to the other dentist as opposed to the old FedExing over the film, and certainly this is a lot more accurate now and a lot more efficient, and many benefits that you just described. So appreciate that, Dr. Thomas.
Sure.
Dr. Callahan, there's one other area that has certainly seen significant advancements through dental technology, and that is something called DASH, which is the in-office tooth whitening system. And I wanted to ask you if you could tell us about that, please.
Sure. DASH is the latest in tooth whitening systems. So tooth whitening has gone through many revisions and improvements.
Wasn't Zoom one of them?
Zoom was one of them.
Yes.
The difference between DASH and Zoom is Zoom had a light. So it was a light-activated whitening system. DASH no longer has the light. So it's easier for the patient. The light caused a lot more irritation to the surrounding tissues, which the DASH does not. And it causes much, much less sensitivity. So a lot of people had sensitivity issues after whitening for many, many years, and the DASH is the latest improvement, which I think has improved it tremendously.
And who would you say could benefit from the Dash tooth whitening system?
People that are unable to use many of the other types of whitening. People that have hypersensitive teeth, or people that have root surfaces exposed that are unable to use whitening systems either over the counter or those at the dental office. Most people will try like a tray system, which is an at-home whitening system. But the solution, if there's any sensitive spots, irritates those and it makes them unable to use it. So people with root surface exposure, periodontal disease, generalized sensitivity are the best candidates.
Okay, and that brings me to my last question regarding Dash, and that would be, what type of results can we all expect from it?
Results in whitening vary from person to person, but the Dash results have been tremendous. Sometimes we'll get 10 shades lighter.
Wow.
But everybody is different. So some people will not get as white based on the thickness of their enamel, the underlying color of their tooth. But the results overall have been very, very nice.
Certainly happy to hear that.
One of the other advantages of the Dash system is how long the whitening lasts. So a lot of the studies show whitening in general lasting various amounts of time. So the over-the-counter whitening products typically last about 6 months, maybe a year. But the Dash will last anywhere from 5 to 10 years, depending on the color of the tooth.
That's a significant difference.
Significant difference.
We're now going to meet two patients of Dr. Callahan and Dr. Thomas. Welcome, Jacqueline.
Thank you. It's nice to be here.
Oh, it's our pleasure to have you on. We appreciate you taking some time to come out and share your experience with us. And on that note, I'd like to begin, if I may, Jacqueline, by asking you, what dental problems were you experiencing prior to coming to Drs. Callahan and Thomas?
What I can say is that I had some crowding, and between Dr. Thomas and Dr. Callahan, they kind of explained that I should maybe consider having braces put in, and I have had that done. They worked in conjunction with my orthopedic doctor, and it was very, very, very good. I am very happy with the results.
Oh, you certainly seem very happy now. Can you give us a little bit of an idea of what was involved as far as when you know, the time and the number of appointments it took, that type of stuff?
Well, I've been coming to this office, to Dr. Callahan's office, for many, many years. So most recently what I've had done is a root canal and a crown put in as well. It was very, very easy, very pleasing, because she makes you feel very calm. She's very informative, and she also lets you know what she's doing and why.
And that's certainly good to know. So she takes the time and the care to go over everything with you.
Yes,
and
she most certainly does.
Yes, well, it certainly shows you seem very pleased with the results indeed.
I am very.
And on that note, I'd like to thank you, Jacqueline, for coming down and sharing your experience with us.
Thank you very much for having me.
And lastly, before we let you go, to the viewers out there that are watching, what would you tell them about Dr. Callahan and Dr. Thomas?
I would tell them that they're most welcome to come to this office. They make you feel like they're part of the family. They're very welcoming, and they care not just for the health of my teeth, but my overall health. And they're very, very accommodating.
Well, that says it all right there. And on that note, again, thank you for coming down and being a guest on our program today.
Thank you very much.
Our pleasure. Welcome, Susan.
Nice to see you.
Oh, it's nice to have you with us as well today. Let me begin by asking you, what dental problem or problems were you experiencing prior to coming to Dr. Callahan and Dr. Thomas?
Well, I was looking for a dentist. We were in the area, new in the area, and we were really looking for a dentist for our family.
So you're looking for a family dental practice?
Dentist, right.
And you came here, and how long has that been now?
We've been with the practice over 15 years at least.
Oh my goodness.
So my children have grown up with Dr. Callahan, so.
Well, that says a lot. And as far as different dental work that you've had done, I take you've had quite a bit done over the years, in addition to the regular 6-month or annual visits?
Surely. I've had some root canal issues and other things that have cropped up, and my children as well have needed wisdom teeth extractions, and there have been referrals to orthodontists, but any number of things that have cropped up in that amount of time.
All right. And what would you say to the viewers who are watching, your thoughts on Dr. Callahan and Dr. Thomas?
I love this practice. I was hoping to create for my children that idea of being lifelong. You've heard of lifelong readers? Well, I wanted my children to want to go to the dentist and be lifelong in their dental care. And
Yes.
this practice nurtures all of that, from Janice, the wonderful office manager, to Dr. Callahan and Dr. Talmas. It's been wonderful for me and for my family.
Well, I'm certainly very happy to hear that. And obviously, you're now 15 years and counting as being patients of doctors here.
And continuing on for the next 15 years.
Yes, indeed. Yes, indeed. And on that note, I'd like to thank you, Susan, for coming down and sharing a little bit about your experience here.
Of course, my pleasure.
Our pleasure having you.
Thank you.
We're now back with the doctors. I must say both Jacqueline and Susan were very pleased, and they speak very highly about the both of you and your practice.
Thank you.
Well, that's nice to hear. They're
Yes.
both wonderful people, and we treat our patients like we would want to be treated.
Yes.
So it's nice to hear that they appreciate that.
Yes, indeed. Thank you both. It was a pleasure interviewing you, Dr. Callahan, and you as well, Dr. Thomas. Very informative, very helpful, covered a lot, and again, I want to thank you both for being our guest today.
Thank you.
It's our pleasure.
Thank you.